I'm Dr. Allan Spiegel. I'm a neurologist practicing neurology for nearly 30 years. The field of neurology is a branch of medicine that deals with injuries and pathology, as well as function of the brain, spinal cord, nerves, muscles, and how they integrate with one another. I think I'm among maybe 2 or 3 totally United States that actually integrates hyperbaric therapy into a neurological practice. Hyperbaric therapy is a treatment that's been available for nearly 100 years. I consider it among the best kept secrets of medicine. Hyperbaric therapy is a treatment where a patient is lying on a stretcher enclosed in clear glass, breathing 100% medical grade oxygen. You and I are currently breathing 21% oxygen, but we're giving 100% oxygen, and then we increase the pressure slowly. You know, when you go up in an airplane, you feel the pressure in your ears, and you equalize the pressure between your ears and your environment by pinching your nose, swallowing, and ears pop, as they say, and the rest of the flight, it's fine. Well, you're in a pressurized cabin when you're in an airplane, but you feel perfectly comfortable. It's identically the same sensation. So when you're breathing 100% oxygen under pressure, you increase the amount of oxygen that saturates and perfuses every part of the body: bones, skin, brain, spinal fluid, blood, anywhere from 10 to 15 times more oxygen than is normally present. Now, what does oxygen, when you're breathing it at that concentration, do to the body? Number one, it causes new blood vessels to grow into any part of the body where there's not getting adequate blood perfusion. Number two, it reduces swelling and inflammation. Number three, it makes your white blood cells, white blood cells that gobble up dead tissue, that attacks bacteria, any foreign bodies. It makes the white blood cells work much better. It also helps lay down the framework for healing. That's why it's used so much these days for wound care. It improves the immune system. It even enhances the amount of natural stem cell release that occurs every day in your body. There's a certain amount of natural stem cells we all have, and hyperbaric therapy has been shown to increase the amount of dispersal of the stem cells 8 times more than those who are not receiving hyperbaric therapy. You know, the benefit from hyperbaric therapy is not the air around the body that is exposed to the 100% oxygen. It's how the oxygen gets into the body and gets dispersed through the body. Now, let me explain something. You know, some people think that hyperbaric therapy, oxygen therapy, is you get oxygen absorbed through the skin on its own, and you do to some extent. But the value of hyperbaric therapy is you're breathing the oxygen, goes into the lungs, goes into the blood. Now, in grade school, we were taught that you need those little hemoglobin molecules to grab onto the oxygen and carry it across into different parts of the body, different organs. And then it releases the oxygen to the organs, and it goes around again to the lungs and picks up some more oxygen and keeps going around the circle. That's true, but we are super saturating the body so that far more oxygen is not just in the hemoglobin or in the blood itself, but in the serum, the fluid that bathes the blood cells. So that is super saturated with oxygen. What benefits you get stay. You don't have to come back for repeated treatments to maintain it. Of course, if you have another injury to that area, I mean, that's another story. But I've had patients who've had stroke, could not move an arm and leg, came for block of treatment, got better, and that's it. Okay, which is important to understand, because it's not that in order to keep it from regressing, you have to do more therapy. That's not the case. But if you don't do at least 20, you may not get the benefit that you would have otherwise had.